Have you ever felt your body begin to tremble as well as feel angina consistently? Or have you even feared for your life when surrounded by a group of people or family members? This can include sporting events or family events. A panic disorder is an anxiety disorder in which a person might get fearful or discomfort on a regular basis. Panic disorder symptoms include nausea, chills, anxiety, trembling, and high heart rate or accelerated heart rate. Often, this disorder is confused with just regular anxiety due to its similarities they have, such as the symptoms. According to Harvard Mental Institute, approximately 3 to 6 million people are diagnosed with panic disorders, which causes daily life struggles. These struggles are often seen in teens' lives when they first encounter their first attack of panic disorders or panic attack. They fear for their life and they fear that they might lose control of their bodies or even have mental breakdowns throughout the day, which causes really big anxiety attacks. The sources I utilize for this presentation come from journals such as Panic Disorder by Westman and McKinney, Screening Process by Helgren Morton, and Treatment and Effective Treatment by Westman Sturpey. Today I will inform you about panic disorders, the screening process, as well as treatments and the most popular treatments used for panic disorders. Currently, there are 4 treatments in order to help determine if you even have a panic disorder. One is the Quick Psychodiagnostic Panel, which is the least likely used by psychiatrists. It gives a mixed result of positive and negative ratios, which isn't good. The second one would be MHE5 or PDSR, which give poorly positive likely ratios. It isn't that bad, but the PDSR is a little bit better than the MH5 because it gives 100% specificity. And lastly, the most common used tool in order to determine if someone even has a panic disorder, which is the GAD-7 or GAD-7. This tool is essential to determine if you even have a panic disorder. It gives a likelihood of 4.9, which is essential to determine if you even have one. So once someone is determined that they have a panic disorder, the second step would be finding a treatment that can help them and their symptoms that include shivering, anxiety, angina, and much more. So once a person is diagnosed, Mark H. Pollock from University of Maryland, who is a professor and psychiatrist, recommends several treatments that can help cope with panic disorders. One is cognitive behavior therapy, which is CBT, which gives a 70% reduction level of stress. And another would be prescribed medications. These can include Paxil, serotonin, Zoloft, and much more. So although prescribed medications do give off some side effects, people who often develop panic attacks or panic disorders don't care because of how bad they have it. Now, people that don't often get treated and decide not to get treatments at all, they often develop phobias. These phobias can include agoraphobia and antipsychotic for anxiety. Like I said before, although medication is helpful, they do come with side effects, which is something that can either be good or bad for you. This can include more anxiety, throwing up, and overall more shivering. So psychiatrists often said that the most popular and most effective treatment is the selective serotonin reuptake, which gives an overall best results of a 50 to 60% elimination rate of panic disorders. The second would be BDC, which gives the fastest results, and CBT, which gives, once again, a 70% reduction rate of stress. Now, the least likely results that aren't really good are chlorpheniramine and Paxil, which gives a 48 to 50% elimination rate. Although it is prescribed medications to help panic disorder, it isn't likely recommended to use those. And for the most effective results include Paxil or serotonin and CBT all combined. So prescribed medication and cognitive therapy together is the most effective overall. Today I have informed you about panic disorders, the screening process, the treatment, and the most effective treatments used to determine if someone even has a panic disorder, as well as what process it takes to get through panic disorders. I challenge you today to pick one thing that you learned today and spread it forward in order to spread awareness for this mental illness. Thank you.